Hello, everyone, and welcome back to Speaklio English, where learning English is easy and fun.
Hi, everybody. We're so happy to see you again.
How are you today?
I'm doing great. And you know what? Today we have a very helpful topic for you.
Yes, today we're going to learn how to talk to a doctor in English.
That's right. Going to the doctor can be scary, especially in English. But don't worry.
We will teach you simple phrases and easy words. After this lesson, you will feel confident.
Exactly. Whether you have a headache, a cold, or you need to make an appointment, we've got you covered.
Before we start, please remember to subscribe, like, and share this video.
Yes, hit that subscribe button so you never miss our lessons. It really helps us.
Okay, are you ready to learn?
Let's do this. Let's start with making an appointment.
So, imagine you're not feeling well. You need to see a doctor. What's the first thing you do?
You call the doctor's office. You need to make an appointment.
Exactly. An appointment is a time to meet the doctor. Let's practice this conversation together.
Good idea. I'll be the receptionist at the doctor's office and you call me.
Perfect. Ring, 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 ring.
Good morning, Dr. Smith's office. How can I help you?
Hello, I'd like to make an appointment, please.
Of course. What's your name?
My name's Annalie.
Great. And what's the problem? Why do you need to see the doctor?
I have a bad cough and a sore throat.
I understand. Can you come tomorrow at 2 p.m.?
Yes, that's perfect. Thank you.
See? That was easy.
Very easy. Let's break it down. First, you say, I'd like to make an appointment, please.
I'd like to make an appointment, please. Repeat after me. I'd like to make an appointment.
Great. You can also say, I need to see a doctor or I want to book an appointment.
All of these work. Now the receptionist will ask your name. That's simple, right?
Yes, just say, my name is, and then your name.
Then they ask, what's the problem? Or what seems to be the problem?
This means, why are you coming? What's wrong with you?
You need to describe your symptoms. Symptoms are the things you feel when you're sick.
Let me give you some examples. If your head hurts, you say, I have a headache.
If your stomach hurts, you say, I have a stomach ache.
If your throat hurts, you say, I have a sore throat.
Sore means it's painful. A sore throat is a painful throat.
Let's practice more symptoms. Repeat after me. I have a fever.
I have a fever. That means your body temperature is very high.
I have a cough.
I have a cough. That's when you go cough, cough all the time.
I have a cold.
I have a cold. A cold is when you have a runny nose, cough, and feel tired.
I feel dizzy.
I feel dizzy. Dizzy means everything is spinning. You can't balance.
My back hurts.
My back hurts. This is very common. Many people have back pain.
Excellent. Now you know how to describe your symptoms.
Now let's practice the phone call one more time. This time, I'll call you.
Okay. Ring, ring. Hello, health center. How may I help you?
Hi, I need to see a doctor, please. I'd like to make an appointment.
Sure. What's your name?
My name is Tom Johnson.
Okay, Mr. Johnson. What's the problem?
I have a terrible headache and I feel dizzy.
I see. How about Friday at 10 a.m.?
Friday at 10? Yes, that works. Thank you so much.
You're welcome. See you Friday.
Perfect. That's how you make an appointment.
Now let's move to the next part. You're at the doctor's office. What happens?
First, you wait in the waiting room. Then the nurse calls your name.
The nurse might check your temperature and blood pressure first.
Let's practice this. I'm the nurse, you're the patient.
Okay.
Chalet, Annalie, please come with me.
Yes, that's me.
Please sit. I need to check your temperature and blood pressure.
Okay, no problem.
Beep, beep. Your temperature is a little high. You have a slight fever.
Oh no, is that bad?
Don't worry. The doctor will see you now. Please go to room 3.
Thank you.
See? The nurse is very helpful. They check you first before the doctor comes.
Now comes the important part, talking to the doctor.
This is the main conversation. The doctor will ask you questions.
Let's learn the most important questions. First question, what brings you in today?
What brings you in today? This means, why are you here? What's wrong with you?
You answer, I have a cough, or my throat is sore, or I don't feel well.
Second question. How long have you had these symptoms?
This means when did this start? How many days?
You answer for 2 days or since Monday or for about a week.
Third question. Are you taking any medication?
Medication means medicine, pills, tablets, any drugs.
You answer, no, I'm not taking anything, or yes, I take aspirin.
Good. Now let's do a full role play. I'm the doctor, you're the patient.
Perfect. I'm nervous.
Don't be. Knock knock. Come in.
Hello, doctor.
Hello. Please have a seat. What brings you in today?
I have a bad cough and a sore throat. I don't feel well.
I'm sorry to hear that. How long have you had these symptoms?
For about 3 days now.
I see. Do you have a fever?
Yes, I think so. I feel very hot.
Okay. Are you taking any medication?
No, not yet.
All right. Let me examine you. Please open your mouth and say, ah.
Ah,
Yes, your throat is very red. You have an infection. I'm going to prescribe some antibiotics.
antibiotics? What's that?
Antibiotics are special medicine that fight infections. Take one pill twice a day.
Okay, twice a day means 2 times every day.
Exactly. Take one in the morning and one at night for 7 days.
Got it. Anything else?
Yes, drink lots of water and get plenty of rest. Rest means sleep and relax.
Thank you, doctor.
You're welcome. If you don't feel better in 3 days, come back and see me.
Okay, I will. Thank you.
Excellent job. That was a perfect doctor conversation.
Now it's your turn to be the patient. I'm the doctor.
Oh, okay. Knock knock.
Come in. Hello, how are you today?
Not so good, doctor. I have a stomach ache.
A stomach ache? That's not fun. How long have you had this pain?
Since yesterday, it really hurts.
Where exactly does it hurt? Show me.
Right here in the middle of my stomach.
I see. Did you eat anything unusual?
Well, I ate some street food yesterday. Maybe that was bad?
That could be it. You might have food poisoning. That's when bad food makes you sick.
Oh no, what should I do?
Don't eat heavy foods today. Just drink water and eat simple foods like bread or rice.
Okay, do I need medicine?
I'll give you some medicine for the pain. Take it 3 times a day after eating.
3 times a day, so morning, afternoon, and night.
Perfect. Yes, exactly. And if the pain gets worse, call me immediately.
Thank you so much, doctor.
Great. You did so well.
Now, let's learn some really important phrases you might need at the doctor.
Yes, these are super useful. First, I'm allergic to.
I'm allergic to. This is very important. Allergic means something makes you sick.
For example, I'm allergic to penicillin or I'm allergic to peanuts.
The doctor needs to know this. It keeps you safe.
Second phrase, it hurts when I.
It hurts when then you say the action. For example, it hurts when I swallow.
Or it hurts when I walk, or it hurts when I breathe.
Third phrase, can you explain that again, please?
This is perfect when you don't understand. Don't be shy.
Yes, the doctors speak fast sometimes. It's okay to ask them to repeat.
Can you explain that again, please? Or I don't understand. Can you say it slowly?
Doctors want to help you. They will explain again.
Fourth phrase, how often should I take this?
This is about medicine. How often means how many times.
The doctor might say twice a day, or 3 times a day, or once every 6 hours.
Make sure you understand. Your health is important.
Let's practice all of these phrases together. Repeat after me. I'm allergic to penicillin.
I'm allergic to penicillin. Good.
It hurts when I swallow.
It hurts when I swallow. Perfect.
Can you explain that again, please?
Can you explain that again, please? Excellent.
How often should I take this?
How often should I take this? Great job, everyone.
Now, one more important thing. When you leave the doctor's office, you might need to go to the pharmacy.
Yes, the pharmacy is where you get your medicine. You give them your prescription.
A prescription is the paper from the doctor. It says what medicine you need.
At the pharmacy, you say, I have a prescription to fill, please.
Or simply say, I need this medicine, please.
The pharmacist might ask, have you taken this before?
You answer, yes, I have, or no, this is my first time.
They might also say, take this with food or don't drink alcohol with this medicine.
Listen carefully. These instructions are very important for your health.
Let's do one final practice, a complete scenario from start to finish.
Great idea. I'll be the patient going through everything. You play all the other people.
Perfect. Let's start. Ring ring.
Good morning, Health Center. How may I help you?
Hi, I'd like to make an appointment, please. I'm not feeling well.
Of course. What's your name?
Sarah Miller.
What's the problem, Miss Miller?
I have a fever and my body aches all over.
I can get you in today at 3.